Welcome to this educational video about Meckel's diverticulum, a congenital abnormality of the small intestine. We'll explore what it is, how it develops its symptoms, diagnosis, and available treatment options. Understanding this condition is crucial for both medical professionals and anyone interested in learning more about digestive health. Meckel's diverticulum arises from the incomplete obliteration of the omphalomcenteric duct, also known as the vitelline duct, during fetal development. This duct normally connects the developing gut to the yolk sac, providing nourishment early in pregnancy. If a portion of this duct persists after birth, it forms a pouch-like structure protruding from the small intestine, which we call Meckel's diverticulum. While the exact reasons for this incomplete closure aren't fully understood, it's generally considered a random occurrence during development. The pathophysiology of Meckel's diverticulum is largely dependent on its contents and location. This diverticulum is a true diverticulum, meaning it includes all layers of the intestinal wall. In a significant percentage of cases, about 50–60%, it contains ectopic tissue, most commonly gastric mucosa. This gastric tissue secretes acid, which can lead to ulceration, bleeding, and inflammation in the adjacent ileal mucosa. Other less common ectopic tissues found include pancreatic tissue, colonic mucosa, and even, rarely, duodenal mucosa. The presence of the diverticulum itself can also cause complications. It can act as a lead point for intussusception, where a part of the intestine telescopes into another. It can also become inflamed, leading to diverticulitis, or cause a volvulus, a twisting of the intestine around itself. Meckel's diverticulum is estimated to affect approximately 2% of the population, making it the most common congenital anomaly of the gastrointestinal tract. It's often diagnosed in childhood, typically before the age of 10, although it can sometimes go undetected until adulthood. Males are more likely to be symptomatic than females, with a male-to-female ratio of around 2:1 or 3:1. Many individuals with Meckel's diverticulum remain asymptomatic throughout their lives. However, when symptoms do occur, they can vary widely. In children, the most common presentation is painless rectal bleeding, often due to ulceration from ectopic gastric tissue. Other symptoms can include abdominal pain, which might mimic appendicitis if the diverticulum becomes inflamed. Intestinal obstruction can also occur due to intussusception, volvulus, or adhesions related to the diverticulum. In adults, complications such as diverticulitis or bowel obstruction are more common. Diagnosing Meckel's diverticulum can be challenging, especially in asymptomatic individuals. In cases of rectal bleeding, a Meckel scan, also known as a technetium 9-nium pertechnetate scan, is often used. This scan detects ectopic gastric mucosa, which avidly uptakes the radioactive tracer. Other imaging modalities, such as CT scans, may be used to evaluate for complications like diverticulitis or intestinal obstruction. In some cases, the diverticulum is discovered incidentally during surgery performed for another reason, or during an endoscopy or colonoscopy. While specific classifications of Meckel's diverticulum aren't typically used in clinical practice, we can categorize them based on their presentation: asymptomatic, symptomatic, bleeding, diverticulitis, obstruction, and incidental findings. Each presentation requires a different management approach, ranging from observation to surgical intervention. Treatment for Meckel's diverticulum primarily involves surgical removal of the diverticulum, a procedure called diverticulectomy. This can be performed using open surgery or laparoscopically, depending on the patient's condition and the surgeon's expertise. In cases where significant inflammation or complications like intestinal obstruction are present, a more extensive resection of the affected portion of the small intestine may be necessary, followed by anastomosis, reconnecting the remaining ends. A symptomatic Meckel's diverticulum discovered incidentally during surgery is sometimes removed, although this is a subject of debate among surgeons, weighing the risks of potential future complications against the risks of the surgery itself. Currently, there are no known preventative measures for Meckel's diverticulum, as it is a congenital condition that develops during fetal development. Genetic factors might play a role, but this hasn't been clearly defined. Focus is typically on early diagnosis and management of complications when they arise. The prognosis for individuals with Meckel's diverticulum is generally excellent, especially when diagnosed and treated promptly. Surgical removal of the diverticulum usually resolves the symptoms and prevents future complications. Research is ongoing to refine surgical techniques and identify potential genetic predispositions to this condition. Minimally invasive approaches, such as laparoscopic and robotic surgery, are constantly being refined to reduce recovery time and improve cosmetic outcomes. Furthermore, investigations into the genetic and molecular mechanisms underlying omphalomcenteric duct closure during development may eventually lead to a better understanding and potentially even preventive strategies for Meckel's diverticulum in the future.